Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise, injuries, and injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, I talk a lot about ACL injuries. In fact, I talked about one just recently in these Ask Dr. Geier videos. I do well over 100 ACL surgeries, every year, and across the country we do anywhere between 100,000 and 200,000 ACL reconstructions, at least in the United States, every year. But we don't hear that often about PCL injuries. That's the ligament right behind the ACL in the center of the knee. Do those need surgery? It's a valid question, because yes, you can tear your PCL playing sports. You may not even be an athlete. You can tear your PCL in a car wreck where basically your knee hits the dashboard and it drives your leg back and tears the PCL. So are these serious injuries, and do they potentially need surgery? So that's what I want to answer in today's Ask Dr. Geier video. Danielle asks, 3 months ago I ruptured my PCL, suffered a mild sprain to the ACL, and a complete grade 3 tear to my MCL. My MCL is healing well. The orthopedic doctor told me I'd be fine without having my PCL reconstructed. I'm very active. I'm not sure if his advice is best for my future. Well, that is a terrific question, and I certainly don't want to give advice. Obviously, he's your doctor, and I'm just giving sort of my thoughts on PCL injuries and PCL reconstruction generally. Now, let's first talk about what we call isolated PCL injuries. And what I mean by an isolated injury is you only injure your PCL. This is not what Danielle did. She injured at least partially multiple ligaments, and I will get to that. But we'll talk about isolated PCL injuries first, where the only injury you suffer is either a partial tear or a complete tear to your PCL. And unlike ACLs, which usually don't heal on their own, and people often have an unstable knee, and that's why ACL reconstruction, ACL surgery is so common, very often people do well without surgery for an isolated PCL injury. A lot of times that ligament can reattach to the bone where it pulls off, either on the thigh bone, the femur, or the tibia, or you regain. You work really hard with a physical therapist and you get your quad strength back. And so very, very frequently you don't need surgery for an isolated PCL, especially a partial PCL. If you have a complete PCL injury, on MRI, it would be a grade 3 is what the radiologists call it, a grade 3 PCL injury, or a complete tear of the PCL. But again, that's the only ligament. That's where there's a little confusion, especially in high-level athletes, professional athletes. We might consider primary, right off the bat, doing a PCL reconstruction. But even in elite athletes, sometimes we'll try to treat PCL injuries without surgery. Now, you can go through with rehab, work really hard, especially on your quad strength back, and that knee still not feel right. It still feels loose. You still don't have the stability, and so you can go, and if the non-operative treatment didn't work, yes, you can do a PCL reconstruction at that point. I recently did that in a high school athlete. Another doctor had tried non-operative treatment, and was absolutely a valid thing to try, but it just didn't work. So we did PCL reconstruction, and at least so far it's going well. And I actually saw somebody in my office today with a PCL injury, and he really wants to try non-operative treatment. So we're trying a course of physical therapy first. It's absolutely a valid thing to try. Sometimes though, instead of like a ligament injuring in the middle of the ligament, it can pull off the bone, again at the femur, or more commonly at the tibia. So sometimes with those, we'll actually go in and reattach the bony attachment with like a screw, and that can actually do really well. So that can be a variant that sometimes might lead us to do more surgery. A good question to ask your orthopedic surgeon. The last one I'll mention though are what we call the multi-ligament injuries, where you tear 2 or 3 ligaments in the knee. Maybe your ACL, PCL, and MCL, or maybe your ACL, PCL, and what we call the posterior lateral corner on the back and outside of the knee. But yeah, very often we will actually, when you have multiple ligaments involved, basically repair or reconstruct all the ligaments. That's a much more serious injury, much more instability of the knee. So yeah, we talk about basically a very big operation. Not always, because sometimes there's some changes. PCLs, again, sometimes can heal without surgery. and so some people, maybe a combination of an MCL and PCL, both of which often heal without surgery, maybe you can get away with it. But again, in those multi-ligament injuries, a lot of times we'll talk about early surgical repair or surgical reconstruction. As you can tell by this answer, there's a lot of nuance, so it really gets to be a discussion you should have with your orthopedic surgeon. There's a lot of factors that come into play, but that's why it's worth getting it checked out. See a sports medicine orthopedic surgeon, find out the options, and then do what's best for you and would help you get back to whatever your work that you want to do is, or whatever your sport or exercise is that you want to do. Now, have you had a PCL injury, and how did you treat it? Did you do well without surgery, or did you need surgery to get back to what it is you like to do? I'd love to hear your experience. So below this video, share this your experience. I'd love to hear it. Maybe it can help other people going through the same thing. And if you have friends or family members or know somebody, maybe coworkers or teammates that have had a PCL injury and maybe he or she's trying to decide what to do, please share this video with him or with her. I'd really love to help in any way I can. Now, if you like videos like this and you want more information and education and commentary on injuries and injury treatments and injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to connect with you that way and deliver those videos to you automatically. And last, there's so many resources that I only share with my email list on ways to stay healthy and perform your best in sports and exercise. So go to my website, drdavidgeier.com, and enter your name and email. It's completely free, and again, I'll deliver those to you. Really excited to connect with you that way. Remember, if you have had or know anybody that's had a PCL injury, I'd love to hear your experiences. Thanks so much for watching, and I look forward to seeing you right here next time.